Hey, I'm Dan Cronin from the Department of Internal Medicine. I'm here to talk to you today about the Mentor Series, which stands for the Medical Educator's Novel Teaching On-Demand Resource. It's a central repository of best teaching practices for medical educators. So there's an old Japanese proverb that says, better than 1,000 days of diligent study is one day with a great teacher. And that obviously there's some hyperbole there, but I think all of us can relate to that. Where we've had a certain teacher, maybe it's a resident or fellow or attending, where in 2 weeks with that teacher, we learned more than the past 3 months of our training. And we left that experience and thought, man, I wish more of my teachers were like that. Because if they were, my training would be so much more valuable. And I would leave here being a much more competent clinician. For me, that experience was my chair of medicine in medical school. I had a month-long sub-I, and literally in that month, it was more valuable than the past 6 months of my training. And after the rotation, I asked my chair, I said, how do you become such a great teacher? What do you do? Were you always like this? He's like, no, I definitely was not always like this. In fact, I was called to the dean's office multiple times when I was younger for making my learners cry. But I realized how important it was to be a great teacher, because I, like you, had experiences that totally transformed my education. And so I worked at it, and I read, and I listened, and I reflected. And when I left that experience, it made me realize that exceptional teaching is not a talent of the gifted, it is a skill of the diligent. And after that, it made me realize that I also wanted to be a great teacher and that I can actually learn how to do that. So I began to work towards that. But more importantly, I also began to have this vision of how can I train other people around me to be great teachers? Because if we could transform medical education. If we can have better teachers, we have better training. Better training makes better doctors take better care of patients. So the impact on society can be huge. And so far in my early career, through my residency and early career, I've created curriculum for internal medicine residents and students and now faculty for learning how to teach. And I realized doing that there are lots of barriers. The first is a lack of time. People are so busy. They barely have time for the things that are mandatory. How do we give them time to learn how to teach? The next is a lack of scalability. If someone creates the best workshop or lecture in the world on teaching, they might hit maybe 1 or at most 10% of the population who wants to learn how to teach. So how do you scale it to reach everyone? And the third is a lack of repetition. If you were to deliver the best workshop to me on how to give a chalk talk, the next time I might have to actually create chalk talks and give them to my learners might be 3 months from now. And I might be thinking, man, what did you say? How did you teach me how to give a chalk talk? I might be struggling. And the last barrier is the one that I think if we solve it, we can resolve every single other barrier. And that is in medical education, there is a lack of a central repository of best teaching practices. And you think in our career, we love central repositories. Medical students, they have Pathoma, online med-ed. Clinicians, we have clinical care guidelines and up-to-date. But medical educators historically have had nothing. And we're hoping with the Mentor Series to change that. So you can think of the Mentor Series like up-to-date, but for medical educators. Instead of being text-based like up-to-date, it's primarily video and infographic-based. The idea is to appeal to all levels of learners, but also including the millennials and future generations who have grown up on video and visual-based education. And so the way it's structured is it's structured currently around 12 foundational topics in medical education, which we came to based off a needs assessment and the experience of people on our team. And you can see that a few examples of the video content looks like this. So we have some content that looks like this, which is almost like a visually enhanced TED Talk. And other content looks more like an animated video. And the way it's structured is that all 12 foundational topics, they each are their own unique mini-series. And each mini-series is very modular. You can choose to watch one video in it or all 10 videos. Each mini-series has a title package, a brief 90-second video introducing the concept and trying to buy in engagement from the viewer. The next are a series of about 5 to 10 videos that are about 5 minutes in length. And each mini-series also has a summary animated video as well as a summary infographic. And the summary animated video and the summary infographic, it within 5 minutes or less reviews all the high-yield content from the mini-series. So when this idea first came to me 3 years ago, I was really not sure who to share it with. I was hesitant. I didn't really quite believe in being able to pull it off even, to be honest. But I believed in the reason behind it. I believed in its purpose, and that is part of what helped to keep me going on it. And so I first shared it with 2 medical students, Sally Solari and Rana Kabir. Rana Kabir had some visual skills, and they both bought into it. Their eyes lit up when I told them. I said, hey, if their eyes light up, maybe other people will too. And they bought in, and Rana helped me amazingly create some visual look for our videos, did an amazing job, and I credit him in many ways as a co-creator because of that. And so gratefully, we've been funded by 3 different grants so far: the GME Innovations Grant, CRLT, Faculty Development Fund, and then the CME Innovations Grant. And honestly, in any product, you can always use more money, right? But I think the lesson here is that we believed in our vision, and after 3 years of a lot of hard work, literally putting in hundreds of hours of work before having any funding, we now have some payoff for that. And payoff, I mean that we can actually see our vision coming to fruition to help others become better teachers. The first year I began thinking about this product, the team was just me. It was kind of lonely, and I had to work through brainstorm a lot. Do I make this videos or text-based? How do I make this have a great user experience? How are people going to find this? How are they even going to want to use it? And I struggled with all of these questions, and eventually, by the time I met the 2 students, Rana Kabir and Sally Solari, I had a good sense of my vision and the production process. But then as we began to make pilot videos, some of the first stakeholders we spoke to actually were not as excited as I had thought or I had hoped. And initially, it was almost there was some hesitation or some resistance. And I was like, whoa, we believe this is a really strong idea, but this person doesn't. And I think they're way smarter than me. So what does that mean? If we believe at least this will help people. We strongly believe that. We want to help people. We're going to keep pushing forward. And so we responded to the stakeholders' hesitance, their resistance, and tried to investigate why were they hesitant, why were they resistant, what to them seems like why this will fail, why this won't succeed, why it won't be a helpful resource, and try to learn from that and improve our process and improve our resource along the way. And honestly, the biggest risk I took was I put in lots and lots of hours. I literally put in hundreds of hours before having any funding. And to me, that was a huge risk. And I thought, well, worst case scenario, maybe I post these to YouTube for a few people and hope it spreads by word of mouth. Best case scenario, we improve the product and people see actually a polished product that they're willing to buy into. And gratefully, I think now we're at a part where we have some professional production value moving forward. And for me, the risk is I'm taking away from family, from other projects. I'm taking away from maybe learning more about clinical medicine. And I tried to keep up with all of these things, but it was taxing. And so what it really bit into was my sleep. But you know what? It was worthwhile. I learned a ton through the process. Even if I was not successful in launching this resource, I was successful in learning a lot about video medium, a lot about artistry, a lot about different programs, a lot about user experience and user design and design thinking. And I learned a ton. And so I grew a lot through this. I did not expect to have that growth, but by taking this risk, by being a risk taker, it caused me to grow in more ways than I even expected. And now we're at this place where we have had an amazing team come alongside us. For one, we have incredibly enthusiastic stakeholders. By that, I mean students, residents, fellows, leadership in UME and GME and faculty development. And their enthusiasm just excites me and makes my passion burn even stronger. And also, we have this incredible team of people who are actually literally part of our close-knit unit. I've found such strength from this diverse group, and I've learned so much from them. And they're all, way smarter than me. And the fact they're willing to come in and help us as a team and come together as a unit, we're basically creating this tight-knit team which all shares the same mission, same values, same purpose. And because we all have these different skill sets, we're able to learn and grow together as a team and from each other, and I think make this resource even stronger. As I went through that and kept on reflecting on feedback I got from different stakeholders and even different mentors, I began to think of, having a diverse group of opinions would be incredibly valuable here. And so for me, I began to reach out to people I began to meet through other programs. And that began to really show me how important a diversity of opinion was. And as time went on, I thought, well, there are plenty of experts here. We're at U of M. We have experts in the medical school and DLHS and Central Campus. I'm just going to start crowdsourcing opinions. So I began to reach out and just ask people, how would you make this better? Why would this fail? What could make this even more successful? Why would people want to watch this? And by crowdsourcing these opinions, it became this huge source of really enlightenment for me, just learning from different schools of thoughts. If I had an idea of how this might be most successful, but people had better ideas and ideas that were additive or supplementary or different. And we didn't keep all of those new and different ideas, but we kept some of them, and it made us think critically. And so I think for me, why I've reached out to so many diverse people, just because I could tell how much that changed my own critical thinking and how much that changed the final product. And it helped me see beyond the blinders I didn't even know I had. So in reflecting on this experience and trying to think of what did I learn from this that could help other people who are trying to be innovative, I think the first thing is if you have a vision and you believe strongly in it, you should keep chasing that vision. But don't get stuck on your first vision necessarily. Be open to feedback, be open to diverse opinions, and as part of that, ask people around you. Don't be afraid that your idea might not be good enough, that you have to show a proof of product first. I think there's some component of having a polished vision before you present it, but once your polished vision is there, consider repolishing it. And repolish again, based on what other people feedback to you. It's critically important. The next thing is built off of that. Don't be a one-man band. Try to build a diverse, strong team around you. For me, I'm not a research scientist. I'm trying to improve that skill. I'm an implementation scientist. I don't have a PhD in education. I love reading about it. I've learned a lot about creative curriculum, but it's the people who know more than me. And so build off the strengths you have around you at this institution and even beyond, if that's where you want to take this. The third thing is persevere. And the fourth thing is have fun with it. If it's your vision, if you're passionate about it, have fun with it. It's an amazing opportunity to be somewhere like this where we are promoting innovation. I'm so grateful that I'm in an institution who actually does that. Get out there, start innovating things, and test your ideas. Thank you. Have fun.